we will be transmitting the webinar from here today. We also have among the organizers here Markus Gastreich from Germany. He will be sort of the helping hand today. If someone has a problem or something, please type that in the chat box, and he will be helping you resolve the problem if possible. A few organizational things up front. I will go ahead and mute everyone to enhance the audio quality. It's a little disturbing if we hear background noises and stuff, so that's the reason for that. The webinar will be two-tiered. The first part will be a presentation in PowerPoint, and please keep your questions till after the presentation. You will then be able to type your questions in the chat box, and we will go through the questions accordingly. The second part of the webinar will be a live demo of LeadIT, and it will go through the most important features and how they can help you resolve productivity problems in your company. And the same here, please keep your questions till at the end of the demo, because most questions I'm sure will be resolved during the demo. I will try to explain everything, and we will go through the most important things. After the demo, you will then again be able to type your questions in the chat box, and we will resolve those questions. So I think without further ado, we will be able to start now, and I hope you enjoy this webinar on productivity. So as stated in the invitation, the title of the talk is Enhanced Productivity. So this is really a critical issue for many companies out there, and in order to give you sort of an introduction to that, we will take a look at the status of the industry, because these things are inherently linked to each other. So the industry, as we all know, is really sort of in a dire situation. R&D spending in the industry and in NIH has almost doubled in the past decade, but the outcome of newly released drugs, newly approved drugs by the FDA has not enhanced dramatically. So this really has a severe consequence on marketed drugs. Patents are waning. About 200 billion sales dollars from big pharma are at risk, and in the past 4 years, so 2010 to 14, estimated about $100 billion in sales are lost. So the pressure increases also because about 70% of all drugs today in the US alone are generics. And pharma companies will only be able to replace about a quarter of lost revenue. And so we can really ask ourselves, what is the primary reason for drug pipelines drying out? So as this picture, as the figure here shows, we have a problem with effectiveness, and we also have a problem with efficiency, because a drug company R&D, instead of generating profits, returns only 70 cents on every dollar spent. This was found by Bernard Munoz. He's a former Lilly employee, and he is now the founder of the Innothink Center for Research in Biomedical Innovation in Indianapolis. So this is a problem, and before actually looking at how we can improve productivity, we need to define productivity, what that actually is. And productivity can be defined by this rather simple equation. This is called the pharmaceutical value equation. So productivity is proportional to the work in progress. That's basically all the projects that are conducted simultaneously at a pharmaceutical company, times the likelihood of technical success, times the value that that research creates for a company, divided by the cost and the cycle time. So it's quite logical that when we reduce the cost and or the cycle time, we will not maximize, but we will enhance productivity. All right, so this is the pipeline for a regular pharmaceutical company. So we start with the target to hit. Everyone knows that. We go through all the different stages here, and then finally, if we are lucky enough, we launch ready to launch product. And as we do here, as we do see here, cycle time and costs are substantial. The hit to lead phase and the lead optimization time together make up about a quarter of the cost for a new molecular entity. That's the capitalized cost, roughly $2 billion for one drug to market. So a quarter of these costs is about $500 million. The cycle time for these two stages combined is about 4 years, roughly 3.5 to 4 years. So we can, in order to look at the cost and what happens if we reduce cost, we can do a very simple calculations. About 4 months, shaving off 4 months of that cycle time would save us roughly $50 million. There's another source, actually it's quite an interesting paper, Pharmacoeconomics, that has a kind of a different approach to that. But here we still do save, if we shave off 10% of that time, we do save about 1% of the overall cost that it takes to bring a new molecular entity to the market. And that is still about $18 million, 1% of about $1.8 billion. So that's quite substantial. And we need to look now at locations where we could enhance productivity and shave off cycle time for projects. So I put up a picture here of the Berlin Wall, and you might wonder what that has to do with pharmaceutical industry. It's quite astonishing that when we as a software company come to a customer, it is astonishing in how many times we find walls, either literally or figuratively, between different departments. And most often there's a large wall between the computational chemist and the medicinal chemist. So what we are asking ourselves, what can we do about that? And of course, we are not the only ones that have found that. In fact, Chris Lipinski already stated that a rational dialogue between medicinal chemists and computational chemists can be very productive. So there's the word productive. So that dialogue alone can be a means of enhancing productivity. MedChemists and CompChems should be talking to each other. And so there was also an interesting source that I found how they can be talking to each other more productively, more easily. And that source that I found was actually from the Kellogg School of Management. Professor Hughes found that there are basically two things that would enhance this process. The first would be to develop an evolutionary technology that improves the speed and or accuracy of an existing process. So keep that in mind, the technology that improves the speed. And the second point was to develop a large team-based interdisciplinary technology. So again, interdisciplinary is exactly what we are looking for, namely the disciplines medicinal chemistry and the discipline computational chemistry. So these 2 points here. And actually, Chris Lipinski again had this notion that it is important that the medicinal chemist takes ownership of your idea, meaning the idea of the computational chemist. If there's a team between the computational chemist and the medicinal chemist, it is much, much easier for the computational chemist to convince the MedChem to synthesize structures. The whole design process will be influenced much more effectively if the medicinal chemists from the get-go are a part of that design process. So there's another advantage of this team formation between a medicinal chemist and a computational chemist, and that is using the medicinal chemist's amygdala. That's actually also something that Chris Lipinski was stating in one of his talks, that medicinal chemists use the use the amygdala a lot. This little piece of the brain here is responsible for emotion, empathy, and love. And medicinal chemists do like good structures. They know when they see a good structure. It is really sort of a process that goes through the through emotions. And to support this, we need a software that enhances this whole process. So basically, if we put all this together, there are basically three things that support this whole process. The first one is the software needs to be interactive, meaning it needs to be so fast that the results come in within seconds, so that the medicinal chemist can see right away the effect that certain changes on molecules have, and what kind of structures would result from that, so that they can make a very quick and very sort of irrational selection. Google would have never been successful if it would have taken a long time for search results to come in. So if you type a search term into Google, you'll see the results right away. In kind of a similar fashion, we need to have results on structures that we modify. The second very important point is the software should be visually engaging. So it should please the medicinal chemist's eye. We need to have 2D structures. We need to have a certain concept that can be read of the structures right away without actually looking at rows and lines of numbers. So that's a very important point. And the third is the software should be easy to learn. It should not be necessary to consult a manual every time you pick up the software, because let's be honest, hardly any software is used on a daily basis, with the exception of lab notebooks maybe. But any other software is probably used every week or every other week. So every time the software is picked up, it should be very learned by intuition and not by a manual. So all this is incorporated into LeadIT, and the step where we need the interactivity most is this improvement step here. And basically, compounds can be improved 3 different ways. That there may be some more, but this is the most important ones. The first is we actually have a core that we need to replace because we have patent issues, because the compound maybe needs to be improved with respect to the admitox properties. It might be a compound from an older project that we look at in a new context. And so we need to replace this core, but we want to leave the peripherals, the residues that are responsible for binding. We need to leave them where they are. So basically, we don't want to touch the bioactive conformation too much. So we replace this, and by that we enter a new chemical class and resolve the issues that we have. The second modification that we make is actually an improvement. Namely, we have a fragment from a crystal structure screen or from a soaking experiment, and we want to develop this fragment into the depth of the pocket. So that, again, should happen under conformational requirements that make this whole new compound fit into the pocket and the fragment doesn't necessarily move too much of its position. Of course, it's a little more flexible than up here. And the third is we have 2 fragments in different sub-pockets of the active site, and these need to be linked or merged. Merged if they coincide in some places, and linked if they basically just need, as the word suggests, a linker between them to make a new, larger compound with improved binding affinity, so that these two subpockets are now connected. So, and once we have these, they need to be somehow validated sometimes, because we are not so sure about the confirmation that we get. So this validation can happen, for example, through docking, and that's also possible in LeadIT. However, we will not cover this today. We have the docking module FlexX in LeadIT, and that's it's one of the, it's the longest standing commercial docking package on the market, having been cited more than 1,000 times. So this is a very well-known and very validated package. So this can and should be used if you are unsure about the confirmation, and you want to make sure that the confirmations you have come up cluster nicely in the pocket. And then the third part is, is actually to understand what you came up with here, and understand potential problems that you still envision that you want to resolve. So this can and should be done with our binding affinity assessment tool HYDE, that tells you where your compound binds well and where it doesn't bind well. And this is a circular process here. So again, when you detect potential further ways or regions on the molecule that need to be improved, you can engage the circle again and further improve, validate, and then understand again. Look at your visual affinities, and this concept will become clearer when I show you a few slides to explain what HYDE is about. Okay. So the improvement part can be done with LeadIT Recore. It's really like a Google type rescaffolding. The team of computational and medicinal chemists together defines which bonds to cut towards a certain core. And once this has been done, they just click a button, and the software displays within a few seconds suggestions how to fill that gap that has been created here with a single rigid fragment that simply makes the connectivity to these residues that have been left where they are. And the requirement for this is that the overall conformation, as you see here, doesn't change too much. This is not a minimization. We've simply formed the bonds between the new atom of the bonding partner and the old atom of the bonding partner. So the fragments that are inserted here are single entity, and they are rigid. That's very important to know, because once we start calculating a conformation, we are again in the gas phase, and this is what messes up our bioactive conformation. So this is really like a Google process here. You define, just like you enter a search term in Google, you press a button just as you type search, and then a few seconds later your results come in. Now, just as Google needs to process the internet or all the web pages beforehand to see how, in which ways they are linked to each other, we need to do a similar thing to process the fragment database so that we can search so interactively fast. And this is done by indexing the fragment database beforehand. And basically the way this is done is we have a bunch of 3D compounds that, according to shredding rules, we fragment into fragments, and this is indicated by these yellow or orange bars here. So these resemble basically the cutting rules, although they may not be exactly the same cutting rules that you will find in the software package. They are just for illustrative purposes here. So we have, for example, identified 3 bonds to cut towards this fragment here in the middle. So on these places, on these sort of bleeding bonds, we now put exit vectors. This is simply a bond that is cut in a certain direction. That's all. It's basically just a vector that's now the software determines the relationship. This information, so the index now contains all this information, how the fragments can. Oh, I'm seeing just my helping. Okay, no, obviously there were just some problems with the sound. I'm sorry. Marcus just let me know, but it seems to be okay now. So Marcus, please do let me know in case this happens again. It happens that my computer is overloaded. Maybe I'm talking too much. Anyway, so we now have this index with the information of the fragments and the corresponding exit vectors. And this is simply comparable to Google having a web page and all the links from other pages that link towards this page. It's very, very comparable. And this information is our index. So now we are able to, when we have a fragment that we are cutting out, and here you see the exit vectors that the team of computational and medicinal chemists defined together, when they press the search button, RECORE simply looks in the index where it finds a similar arrangement of exit vectors on a different fragment that it can place inside this gap here. And so it happens that the list of results as they come in, just as in Google, is rank ordered. In Google it is the page rank. In RECORE it is the deviation from the original exit vectors that have been defined by the team of computational and computational chemists. So the list of results is rank ordered, and it comes in within a few seconds. And so irrespective of the size of the database, the search time is roughly not affected by that. It may be by a little bit, but not much. So if you have 10,000 or 10 billion fragments in your index, it doesn't matter. You will always find these results after the same amount of time roughly. So the advantage of this is because the process is so fast that the medicinal and computational chemists can sit together in front of a computer with a good cup of coffee and within a matter of an afternoon come up with a bunch of structures that both are happy with, especially the medicinal chemists. So they basically take ownership of the idea and together with the CompChem select structures that they like to take back to the lab and synthesize. So as you might have seen, this process replaces basically a bunch of project meetings that happen every week where the computational chemists suggest a few structures and then the MedChems either have their own ideas or they have some enhancement suggestions, and the CompChems go back to their computer and work on these enhancements, and then the next week there's another meeting and so forth. So all this is superfluous because they already work together and they basically come up with all these ideas together within the matter of an afternoon. But before the medicinal chemist walks back happily to the lab wanting to synthesize, it might be necessary to prioritize these compounds, whether it actually makes sense to be synthesized. And this can be done with our binding affinity tool called HIDE. HIDE is a tool that assesses or takes into account the hydrogen bonding energy and the hydrophobic effect, essentially the desolvation energy. So when you have a compound in a pocket and you want to know if that compound binds well, you engage HIDE, and a few seconds later, HIDE color codes the compound for you, showing you which atoms contribute favorably to the score and which atoms don't. For example, here's an NH atom, as you've seen from the previous structure, that's supposed to form a hydrogen bond with the carbonyl backbone here. And it might be close to the carbonyl backbone, but the hydrogen bond is of crooked geometry, so that the energetic contribution of this hydrogen bond is nil or negligible. So the effect of that is the desolvation energy that this atom has had when it came from the solvent into the pocket cannot be overcompensated by a hydrogen bond, and as a result, there is a penalty this atom has to pay, and this will probably be in between 4 and 10 kilojoules per mole, depending on the geometry here. So this is 1 to 2 orders of magnitude in binding affinity. So due to that penalty that we pay, false positives are much less likely to happen, so we simply do not count favorable interactions, but we also take into account the very unfavorable ones. So conversely, back here in this hydrophobic pocket, there's a methyl group. The methyl group basically is very happy here, and so that's the hydrophobic effect. It contributes favorably, as the color green suggests, and everything is good. So basically, at one glance, the researchers can see the effect that the changes have had on the binding affinity, and can make improvements accordingly. Just a little bit of the background for HYDE. This here is everything that you need to know about HYDE. It is simply we express the change in free energy of binding for each atom I by the sum over all atoms I for the molecule of the change in free energy of dehydration for each atom I plus the change in free energy of dehydration of hydrogen bonding for each atom I. So when the compound is taken from the solvent into the pocket, and actually this is a little misleading, it should be in the same conformation. We don't change the conformation. We simply count how many hydrogen bonds are formed between the compound and the receptor, and we calculate the change in hydrophobic surface. So that's basically the whole concept behind HYDE. The advantage of this is we simply have just 1 or 2 descriptors, namely the hydrophobic surface and the hydrogen bonds. And if we take into account only the hydrophobic surface even, we are doing very well on in binding affinity prediction on the PDB bind data set. This is a very very hard data set, I should say, because the information comes from all different kinds of sources of information about binding affinity. The complexes come from different labs, and so it is very hard to have a congruent picture of the data. And yet, we do get a Pearson correlation of 0.6. So, and keep in mind that HYDE has not been calibrated on any protein ligand data. HYDE is simply derived from simple physical-chemical concepts, as opposed to all these up here that are not doing so much better. And as you can see, they are basically calibrated on protein ligand data. In fact, X4 has been calibrated on the PDB bind, so it's no surprise that it performs the best here. And the number of descriptors or atom types is very, very low for HYDE. So we can basically score protein ligand complexes, protein-protein interactions, all different sorts of stuff. And the nice thing is we do get this visual feedback here. We get basically a disturbing delta G contribution, get the color red, and for a favorable delta G contribution, we get the color green, so that at one glance we can see where there's a potential problem. For this particular example here, there is an opposing oxygen atom of the molecule to a carbonyl backbone. Both atoms experience a loss in desolvation energy when they are desolvated, and they cannot overcompensate this loss. As you can see, it's almost 11 kilojoules per mole. Very bad penalty, 1 to 2 orders of magnitude in binding. This aromatic carbon here is basically experiencing the hydrophobic effect. It's very happy, -7 kilojoules. And here, this nitrogen is indeed forming a hydrogen bond of very good geometry, so it is right smack in the middle of the minimum. And this time around, we can overcompensate the loss it experiences in desolvation energy and we get a small contribution for this particular interaction. So this is the whole concept behind HYDE. So HYDE we can use, for example, in lead optimization. We can use it to detect activity cliffs. These molecules here are a little small, but as you can see, compound 8 has a larger group here, and is doing okay binding affinity wise, but if we reduce this group to an amino group, compound 7 here, we see that we do get an improvement in binding affinity. So here's the Ki for both compounds. Here's the experimental delta G that we derived from the Ki, and HYDE is overexpressing this a little bit, but it's the trend we are after. We are not after the actual numbers here. It's really the trend. Speaking of trend, activity trends can also be calculated by HYDE. And this is an example for thrombin here where the data comes from the same lab. All have been measured in the same lab. The crystal structures have been made in the same lab, and also the measurements for Ki. And as you can see here, there's a nice trend for these different complexes for thrombin that HYDE actually picks up very, very nicely. That's not always the case. I'm not saying that we can, on a quantitative basis, predict the binding affinity, but that's, again, not what we are after. We are after a qualitative assessment if a change in a molecule is actually giving us something better than what we started with. That's what we are after. So this is small molecules and protein. Here as a last example, this is protein-protein interactions, and as you can see here, HYDE actually detects correctly the 2 amino acids, actually it's 3, 4 amino acids that are hotspots on the protein interface. And so in black we have the experiment here, and in green we have the HYDE calculation. So HYDE really picks up correctly the change in free energy change for this protein-protein interaction. So this is a few examples that we can use HYDE for, and we can use it for many, many more things. Virtual screening, for example. I mentioned docking. We can rescore docking complexes. For lead optimization, I've given you a few examples for core replacement. Fragment linking, merging, and growing. We can see how we are doing there. We can use HYDE for activity trends, compound prioritization, and for all this, the advantage of HYDE really is that we do get this visual interaction. We do get the visual feedback. We don't have to read numbers, for all these changes that we make, because numbers don't tell much. Numbers are very abstract. We want to see where we are doing well, and we want to see potential problems where we need to engage again and make a change, so we develop into the right direction. This is a very important concept in crystal structure elucidation. When we look at a crystal structure and we see an area of red, we know that there is a problem. We know that, for example, there's a conserved water missing, or that the electron density hasn't been filled correctly, and that might point out to a structure that has a bad resolution. So it is really, really helpful to look at the colors here. Also, elucidation of drug resistance HYDE has been used for. So let me come back to this picture of the wall here. This is November 10, 1989, and a few weeks later the wall crumbled. And just as the wall in Berlin crumbled, we would like to see walls crumble in companies by enhancing the communication between the computation and the medicinal chemist and other, maybe also biologists, in order to form that team and in order to really save time and by that enhance productivity. And I hope this concept became a little clearer during the past slides. So let me now wrap this up and tell you again what we talked about, and most importantly what is in for you as the user of this software. So most importantly, it enhances interactivity You can form a team. You can interactively come up with modifications of compounds and assess right away within a few seconds if this change indeed is leading you into the right direction. You can find those compounds that matter most to you in terms of conformation and in terms of synthesizability, because you have your buddy, the MedChem next to you, that can tell you, yeah, sure, I can make that compound. It looks nice. I like it. It's a good structure. And because you get this visual feedback, you can decide right away whether it probably makes sense to synthesize a structure or not. So it's very easy for you guys to prioritize your compounds and probably sort out those compounds that would, waste resources and are not really leading you into the right direction. So you guys can decide more quickly and, most importantly, with more confidence which compounds to synthesize. So, and I hope that this concept really is helping to enhance productivity, even if it's just a week or two that can be shaved off from a project. That's still a couple $1,000,000 bucks. So whereas this might not hold true for all smaller companies, I'm sure that a little money can be saved in some companies as well. So this was the first part of the webinar, the presentation. If you have questions now, please type them in the chat box, and I will be happy to go through them. When we're done with the questions, then we can start with a quick demo here. Yeah, or as Marcus suggests, you can raise your hand, type it in the chat box, raise your hand, and I will unmute, and you can ask the question also via the audio. No questions means either everything is clear or everyone is confused and doesn't know how to ask the question or how to start asking questions. Okay, I'll wait for maybe 1 more minute, and then I will start with the demo. Take a little break here. All right. No questions? Then we will go ahead and start the demo. So I'll open up LeadIT for you here. This is the interface of LeadIT. Very simple, very few buttons. We don't need a lot of buttons. This is basically for your projects. A project contains all the data you're working on, PDB, complexes, ligand complexes, the parameters you're changing or maybe not, any comments you make. So this is a new project, open project, save project. This is the 4 modules that you need in order to work with LeadIT. Load a protein and prepare the receptor, FlexX docking, recore, core replacement or fragment growing, linking, merging, and this is the hide binding affinity assessment. The thumb, basically, as you will see, shows you good score, good ligand efficiency. So I will go ahead and load a PDB complex and walk you very quickly through protein preparation. Just a few minutes, so you can draw it directly from the PDB, or you can load the complex. Here you see the protein with the co-crystallized ligand in a different thicker line notation. You click the next button. The chain is selected automatically if it's only one chain. If the metal atoms here, if the metal atoms are far away from the active site, you don't need to take them into account. Otherwise, you need to check them here. And then just click next. The binding site is automatically selected for you when there's only one ligand structure present. And now probably my sound will go back again because it calculates a little bit. Here you can now look at residues and accordingly change them if you need to, meaning the charges, the flips, the protonation states, that all that is calculated automatically by LeadIT. The only thing I need to do here, because I looked at it before, it's LeadIT, and you know that LeadIT has a keto function here. So I need to change the tautomer, which is done under small molecules, edit ligand, and I right-click on the molecule, and I can say change tautomer to the right tautomer here. You see now that I now have this double bond to the oxygen. I have my NH here, and as you see here, pay attention to this amino acids. When I now save the structure, the amino acid will flip automatically because everything is calculated automatically. So yes, save changes. So you've seen that flip. So now we have 2 hydrogen bonds to that structure. And this was everything that's necessary in order to prepare this protein, active site, and the ligand. All right, so we can finish that. So now I will show you how to manipulate that structure interactively. I will change to the report query menu here. So now I have my protein. The co-crystallized ligand is gone because it is basically not present for require unless I load it. So, and also keep in mind that the protein preparation you only need to do once, provided you press the save button. The protein is saved in the state that you've prepared it inside your project, and you only need to do this once. And as you can see, it's very, very fast. So if I want to work on the co-crystallized ligand, I need to add it, and I do this next to the add button. There's a little arrow here. I can load an external file, which is the same as if I would press add here, but I can also choose the reference ligand, or I can choose a ligand from a docking library that I have previously loaded. Again, docking we will not cover. This will be a webinar on Thursday that Marcus will give, and he will tell you everything you need to know about docking. So I choose the reference ligand, and I will now show you how to manipulate that structure. I will place a few cuts, aka exit vectors, but I like I like the term cuts much better because it's more chemical. Basically selecting that central ring system here, and I just want to give it a few more, a little more information, because I know that at least this hydrogen bond here is important. I now change to the advanced options, and I choose sphere constraints, and the sphere constraints are very, very powerful. You can place a sphere basically anywhere on the ligand, next to the ligand, on the protein, inside the active site, anywhere you want, and you can give this sphere any sort of smarts expression you want. So everything that can be expressed in smarts, every property you can put onto a sphere. And you can make that an inclusion or exclusion sphere. So you have a lot of leverage on how to define the chemical surrounding or chemical space on or next to your ligand. So now I want to include only receptors here. So I click on the oxygen, I place that inclusion sphere. I see here that this smarts expression, which is the same as these receptors here, is augmented by this property, and I can now change the size a little bit to half an angstrom basically. So this here is the sphere. It's placed on the oxygen. I add this to my search term, and now you see that there's a green inclusion sphere on the oxygen that says in this area I want to have only acceptors. And the other thing I would like to do is I would like to restrict the search volume a little bit, so I incorporate the protein as an excluded volume. We don't do that by default, because sometimes you know that the protein active site is very flexible, or you just want to know what kind of chemical space you have in your index, so you don't want to over-constrain yourself too much in the beginning. So now I apologize in advance if my sound is bad. I will stop talking until the search has finished, which is basically just a few seconds. I will press the recall button now, and it will search for replacements for this ring system here. That wasn't long, was it? So we now have 25 structures, and don't assume that this is the end of the search. Recourse suggests 25 structures initially. You can always search for more if you scroll down to the bottom of this list, and it'll give you in 5 chunks more and more and more and more solutions. Either you're tired, or until your finger is tired, or until you have basically seen everything. So let's go through these. It's very comforting actually that we find the exact same ring system on rank 1 here. So that seems to be working very well. We can now browse through those solutions here, and we can take a look. All of them have acceptors in this area, and we can now basically just take a look at these structures. Some of them are occurring twice, which doesn't bother us too much if it's not too many that occurred twice. And we go through these further down until we find on rank 6 here actually a very familiar ring system. That's the ring system of Viagra. The original structure we looked at, you might have seen it, is Levitra, and on rank 6 we find Viagra. So now we are curious to see how this ring system in comparison to the original structure is assessed in binding affinity. And so we choose this, we click it here, we right click in this row, and we get a menu, a context menu that lets us either dock the structure, or we can use the selected composite for height assessment. And we will do that now. So I will click that, and this structure will now be taken to height, and I'll stop talking and wait until this is finished. Okay, so that's again a very comforting result. We get this in a nanomolar range. Again, the number here is not so super important because, like I said, we don't claim to be able to quantitatively predict. But again, if the data we are working on is very, very good, then the numbers get more and more reliable. So if you have a protein that has a very, very high resolution and you're very, very confident about the electron density, then the numbers get more meaningful. So you've seen that we've used now 10 minutes to manipulate one structure and get confidence about one of the results, which happens to be Viagra. So we basically made a scaffold hop from Levitra to Viagra. We omitted this little tail back here, but the ring system is the more important one. So now when we take on further with this speed, we can make 10s, 20s, 30, 50 different variations of this parent compound within a few hours, including talking about the structures. So other methods would use at least a day or two for this whole process. So it's a very, very interactive process. And if we now would like to compare this this here to our original compound, same thing. We next to the load button here in hide, we can have this little, we can pull down this little menu. We take the reference ligand, we click the reference ligand, and I'll shut up now again until this is finished. Keep talking then. So just as we assumed, it's roughly the same. It happens to be identical now, but it's roughly in the same nanomolar regime. Ligand efficiency is okay. And these two molecules, as we know, are both blockbuster drugs. We've just sort of recreated this, this scaffold hop within just a few minutes. And so I would like to show you now, go back to ReCore. So this was a scaffold hop with, by using the advanced options here in LeadIT, next to the sphere constraints that I mentioned are very powerful. We have those pharmacophore features, which are not an either-or constraint, but they're kind of a sort of a nice to have. So if you use a pharmacophore feature, it is almost as using an exit vector, a bond that you cut, only that the feature is basically a nice to have. So if the software finds a fragment that fits better inside these cuts here, but that doesn't have the feature in the right area, it will place it as close as possible. But it's, like I said, it's not an either-or. If you need an either-or pharmacophore constraint, I advise you to use these sphere constraints here. They are working as a filter, and if the filter is not fulfilled, if that constraint is not fulfilled, then you will not see this solution. So that's why, again, my recommendation, don't overstrain yourself. Work from hardly any constraints up to many constraints if you have to, but not the other way around. Okay, so that's the advanced options here. I just want to mention these big buttons here. Those are the mods you can use ReCore. This is the core replacement part. This is growing, which I'll show you. And this is the link for which you need 2 molecules at least. And then you can link them together. So I will now clear off and the recent fragment, and I just want to quickly the growing mode in which you can enhance a fragment of the. Sorry, I have to turn this a little bit. This will probably compromise my audio again, but so I will work towards alanine, use this as a constraint and towards this phenylalanine. If I click twice on a bond, the direction of the exit vector changes, and now as you see here, the rest of the molecule is grayed out. It is not affected. It stays where it is. So we now change the mode of LeadIT and basically hydrogen bond accepting vectors that we can use as target pharmacophore. We have to use the phenylalanine as a stacking interaction, so we need to change that feature to a phenyl center, and we can now use the vector perpendicular to plane of the ring target for this. Now click record, and I will continue to talk when the calculation is over. All right, so we can see that we now have solutions that are all stacking against them. And that comes to the protein because it is a very constraining excluded volume. But as you can see, all of these solutions basically stack against the phenylalanine. So that's one way in which you can use this growing method. You can either use a phenyl center on the protein as a stacking. You can use hydrogen bond acceptor or donor, but you need at least one vector that you can grow onto as a pharmacophore. So that concludes the demo. I would now welcome any questions you have regarding the demo, kind of features that you missed, any questions towards the how it works. And I'm hoping that you have seen how quickly you can come up with structures, it's possible to get 10s, 20s, 30s, and more different derivatives of a parent compound. One thing I should not forget to mention, Marcus just pointed that out to me, is the quality of your results depends on two things. One is the quality of the protein structure you're working with, and the quality of the index you are searching. So if the structure is not in the index, obviously you will not find it. If it's in the index and if your protein structure is of very good quality, has very good electron density fitting, and if the resolution is very good, the data you're getting or the results you're getting are far more reliable than if you are using a homology model, for example. Which doesn't say you should not be using a homology model. I'm just pointing out to you, if you use a homology model, for example, or a crystal structure of bad resolution, then it's then you should not expect the corresponding good results. Okay, so I'm welcoming questions now. So Guillaume was asking, can you create your own list of fragments to use with ReCore and how? And the answer to this is yes. You can use your own fragments. The requirement is you need 3D fragments, and basically ReCore comes with its own shredding engine. As I mentioned, there's a rule set that ReCore uses in order to break up compounds. You don't need to use full compounds, you can also use fragments, and you can tailor the rules to your own needs. So you can, if you think you need to change those rules, if you say, for example, hey, I want to use my fragments and I just want to cut off the hydrogens of these fragments and then use these fragments as they are, you can do that. So it's not a black box that you have to use it in, but it is really all tailorable, and we can provide you with a script that does the shredding for you and that does the index creation for you. So we will definitely help you do that. In fact, I once worked with a large pharma company, one of the big pharma companies, and they converted their entire internal ligand database into, so first they expanded it conformationally and then they converted that into an index, and the result was that there were billions of molecules, billions of conformations of molecules turned into an index, which led to a gigantic index. I think it was about 20 gigabytes large or even more. So we either provide a script for you or we would do that for you as kind of a service. You know, we are very, our support is very well known for helping you out in that kind of case. Any more questions? Okay, that doesn't seem to be the case. Then I would like to thank, oh, there's one more question. Can you hide all structures at once instead of an individual click? In this version of hide, unfortunately, you have to go, if you want to use the GUI, you have to go through these structures individually. It is possible to score them all sequentially in the command line, so you can just on one command line you can engage hide and it'll return a table of the results to you, but then you omit the visual feedback. Our next version will allow to score all structures at once, well, sequentially, but you press a button and all structures in your library or in your that you've loaded or that you've come up with other, you know, RECOR or docking or whatever that you've loaded, they will be scored sequentially and you will get that automatically. And also there is the possibility to use a Nyman pipeline pilot, of course. All of our tools have nodes for both of these pipelining tools, and you can basically process everything through these very convenient pipelining tools. There's another question here. How does RECOR handle tautomers? Do you have to create an index with individually selected tautomers? Yes, that's correct, because as I mentioned in the beginning, there are the fragments will be introduced into the gap that you've come up with rigidly. So the fragments, once they are processed in the index, are not touched. So if you want to address different tautomers, you will have to put them in your molecular library that you're processing to put into the index. Could you show how to use the command? Yes, I can. Hang on a sec. I'm just checking here that there are no further questions. So let me just open up the command line and prepare this. All right, so here's the command line. You go to Program Files or wherever you have installed this, BioSolve-IT, and then the LeadIT version 2.1. So in this directory of LeadIT, wherever you have your installation, there is an executable called HideScorer, and you just type that HideScorer.exe --help, and that gives you all the command switches that you need in order to engage hide. So the minimum is you need the target as in mol2 or an FXX, and you need the input, which is your molecular library in a mol2 format. So you say HideScorer -- target, my protein file.fxx. You need to prepare that accordingly in LeadIT, as I have shown you. -- input, my molecular library file.mol2, and then you press return, and you will get back a table with the results that you can then interpret. You can select a CSV output format and put that in Excel and then sort according to the score, etc. By the way, the nodes for Pipeline Pilot and NIME are free of charge, so there's no additional charge for that. So there don't seem to be any more questions. Let me thank you again, and don't forget, for all that have participated. Oh, there's another question. LeadIT 2.0 versus 2.1 will give different results. I don't think so, at least not for ReCore. We didn't change anything with respect to the algorithm of ReCore. So for HIDE, sometimes we do see different results. And yeah, like Marcus said, we changed the initialization of the molecule. So depending on the input, if the initializer or the initialization did make a different change on the molecule, then yeah, the result in HIDE will be different. All right, so I think we should, I'm a little over time. We started 5 past. I think we should close the webinar now. If there are additional questions, you're welcome to address them at support@biosolvit.de or .com. Or you can also write to the webinar queue, or you can go to Facebook or LinkedIn, or you can write to me directly. My email address is given here again. It's eatering@biosolvit.com. And don't forget, every participant gets a 2-month license of the software for free, and can play with it and test it out. All right, thanks again for your participation today. Again, the next, there's a question, where do we get it? We will send that information to all the participants, so we'll follow up with you after the webinar automatically. The next webinar will be on Thursday at 8 Pacific, 11 Eastern, and 5 o'clock Central European Time. It'll be about docking. Docking Revisited. Marcus will be the presenter, and I'm very much looking forward to that. So please join us again for this webinar, and then enjoy the rest of your day. Thanks again for your participation, and we'll see you next time at one of the BioSolve IT webinars.